Dentistry webinars. Today's topic is on laminate veneers by Dr. Prashanth Manohar. He had done his BDS from GDC Calicut and MDS in Prosthodontics from GDC Trivandrum. He works as a consultant prosthodontist. Welcome, sir. Welcome, sir, to the session.
Thank you, Dr. Hima. Okay, good evening, everyone. So today we'll be discussing a short topic, porcelain laminate veneers. Hope everyone is familiar with the topic, right? So for our NEET exams, few questions have been asked from this region. So we'll be discussing that questions too. Okay. Am I audible? I want a discussion from everybody. So am I audible? Yeah. Fine. So can we start? Yes, fine. Okay. So laminate veneers or porcelain laminate veneers. See, they are the most aesthetic restoration and which is very much conservative. Okay, which restores the aesthetics of anterior teeth, especially anterior teeth. It can extend up to premolars. Okay, so they are a conservative alternative for full coverage for improving the appearance of anterior teeth. Clear. So it covers the visible part or the front part only. So laminate veneers, they cover only the visible part or the front part of the teeth. Okay. And this is the most important thing. It derives or it gets its retention entirely from resin cement. So don't ever imagine any other luting material other than resin cement for your laminate veneers. Okay. No GIC, no other materials. Only resin cement is indicated for your laminate veneers. Only then you will get your monoblock effect. Monoblock effect means the whole system. That means the veneer, the cement, that means the resin cement, and the tooth structure will act as a single unit. Okay. It will act as a single unit. So that is that monoblock effect. So monoblock effect will be only effective if you use a resin cement. Clear? So directly going into the indications of veneers. Yeah, if you have discolorations due to any other pathologies like amelogenesis imperfecta or mild tetracycline staining, moderate staining, severe tetracycline staining, all these are indications. Even physiologic aging, due to physiologic aging, our tooth becomes more yellow. So that is an indication for veneers. Again, due to trauma, the tooth becomes non-vital. After endodontic therapy, still the tooth will remain as discolored. So to mask the discoloration, either you can go for bleaching or another option is veneers. Okay. So porcelain laminate veneers can be indicated for a discolored tooth due to trauma. Then again, shape abnormalities, mild microdontia and some atypical malformations can be corrected with veneers. So these are all indications for veneers. Malformations, again microdontia. Now enamel dysplasia, they are also indications for veneers. Enamel dysplasia. Then erosion. You have erosions that can be also corrected with veneers. Then attrition. Remember, if the cause of attrition is parafunction, then they are contraindication. Okay, attrition. Again, enamel defects and coronal fracture. Coronal fracture involving your line angles, not the entire length of the tooth structure, means entire mesodistal length of the tooth structure. Okay, they are indications for veneers. So these structures has to be restored with composite, then covered with veneers. Clear? Then mild abnormal position or mild malposition can be corrected with veneers. Remember, mild. Okay. Severe to moderate requires orthodontic correction. So diastema, again, diastema can be also corrected with veneers. Remember, the amount of diastema should be up to 3 mm. Okay, so that 1.5 mm per tooth. You can go for increasing the width of the tooth by 1.5 mm, not more than that. Okay, so maximum 3 mm of diastema can be closed with laminate veneers. Now, what are the contraindications? So these are the indications: any discoloration, any enamel dysplasias, coronal fracture involving any line angles, then microdontia, mild malpositions. All these are indications for veneers. Okay, clear? So this has been asked. So what are the indications? You should be thorough with it. Now coming to contraindications. Insufficient surface enamel. See, we get our retention from resin cement. So we are dependent on the enamel, the amount of enamel. So minimum 50% of the tooth structure enamel should be there. If it is less than that, then it is better to go for a full coverage restoration. Clear? Again, unsuitable occlusion. That means the patient is having a deep bite. Again, it is a contraindication. Sorry. And parafunction breaks, if he is having a parafunctional habit, better to go for some other restorations, not veneers. Okay, again, poor dental hygiene or poor oral hygiene, high caries index patients, all these are contraindications for laminate veneers. Clear? So insufficient enamel, that means less than 50% of enamel, deep bite, parafunction, and poor dental hygiene. Okay, these are all contraindications for laminate veneers. Now, what are the advantages? What are the advantages with the laminate veneers? I already told you, it is the conservative and most aesthetic restoration. So first one, aesthetics. Yes, you have nothing in this world to match with veneers. Okay, you have nothing in this world till now to match with the aesthetics of veneers. Laminate veneers, they are the best aesthetic restoration available. Okay, you can mask any amount of discoloration. You can mask any amount of discoloration with this material. Okay, so that is the main advantage of using laminate veneers, aesthetics. Again, tissue response. One thing is that we are not interfering with the tissues. Second thing, we are using glazed, polished porcelain. So they are highly biocompatible. They accumulate plaque very little. So again, with the bonded restorations, you are not interfering with the biologic properties or biologic width of the periodontium. So tissue response is highly high tissue response for laminate veneers. Clear? Then yes, color. You can mask the discoloration and can offer a stable color for the restoration. Understood? Unlike the other restorations, there won't be any change in the color for porcelain. Okay, so that is again an advantage. Again, inherent property of porcelain and inherent strength of the porcelain, that means when it is bonded with the tooth structure, that means when it is bonded with the resin cement to the tooth structure, it will have a monoblock effect. So the entire strength of the tooth structure will be the strength of the whole system. Clear? So that is the advantage of using resin cement along with laminate veneers. Again, there is no fluid absorption at all. There is no fluid absorption at all. So no need to worry about in that region. Now, what are the disadvantages? Yes, it has got some disadvantages also. Time, yes, it is time consuming. The lab procedure is again time consuming, and preparation also requires skill, and it might take time depending upon person to person. Okay, so That is one issue. Time. Then again, preparation. You have to be very careful because it is very minimal preparation. There shouldn't be any undercut. The preparation should limit within the enamel so that we can get maximum bonding with the enamel. And you have to use, if you are properly using the proper armamentarium, then there is no need to worry about this preparation. Clear? Again, costly. Obviously it's costly because the lab is costly. Again, you are using resin cement and you are skilled. If you are skilled enough, you should charge yourself. Okay, so you should charge your effort also. So definitely the veneers are costly. Now, difficulty in color matching. See, single veneers, they are the most difficult one because to match a single tooth with the adjacent tooth or a single veneer with the adjacent tooth is the most challenging one. And again, once luted, very difficult. If you have properly luted it, very difficult to modify the resin. Means veneers. Okay, it's very difficult to modify that. Then again, during trying, yes, we can give it. We can check the seating of the veneers, but if we are not careful enough, definitely it will fracture. Even recently, my friend 2 days back got one veneer while seating for just checking the seating, it got fractured. He told that it might be due to this faulty impression because it was not properly seated. So they are very much liable to fracture. They are very thin material, very thin material, brittle material. So they can get fracture. Means before bonding, I am saying okay. After bonding, it is very likely to fracture if you have done it properly. And second thing, if the case selection is proper, they'll stay absolutely perfectly there for lifelong. Again, bonding procedure, it has some sequential procedures. You have to follow it. Any error in that definitely will lead to the failure of the veneers. Hope it is clear. So we'll be discussing the bonding procedure in the later part of this presentation. So hope it will be clear for you. Again, repairability. Once cemented, once luted, it is very difficult to repair it. Okay, you cannot repair it again. Means it is very difficult. Side shaping, slide adjustments can be done, but to repair it completely, it will be very difficult. So coming to armamentarium, very limited armamentarium for preparation of veneer, very limited. You will not find any other preparation with limited this much armamentarium. Clear? Only this much is required. You require 3 depth orientation burrs, 1 round and taper burr, and a olive burr. All these is required. Only this much is required for a veneer preparation. Okay. So the A, B, C, the picture what you see in A, B, and C, they are the depth orientation burrs. They are not actually only for your veneer preparation. Okay, they are for the anteriors. Anteriors, you can go for the full coverage preparation also. These depth cutting burrs can be used. So remember, if you get a picture from the A, B, C, you understand that they are depth cutting wheels. Okay, they are depth cutting burrs. Clear? So these are the armamentarium required for the preparation of laminate veneers. Hope it is clear. Till now it is clear. So the indication, the contraindication, and the armamentarium. Till now, hope it is clear, right? I request some response from you all also. It is clear? Yes or no? Yeah, thank you. Right? So coming to amount of tooth preparation. So indication, contraindication, that portion has been asked frequently in your NEET exams. And now amount of tooth preparation, the another portion that has been again frequently asked. So you should know how much tooth reduction is required in the cervical area, middle, incisor, so wholly as the labial portion. And for veneers, there are 2 types of, means actually 4 types are there. You will have a palatal coverage in some preparation. So if you are going for a palatal coverage, what should be the palatal coverage, palatal preparation? Okay. So facial reduction. Facial reduction in the gingival third, it's 0.3 to 0.5. Middle and incisal. I'm telling about the facial reduction. Okay. That means from the labial aspect. So facial reduction, it is from 0.3 to 0.5 mm. You can now assess the thickness of that veneer material because it will be 0.3 mm of thickness in the cervical aspect. So gingival third, it will be 0.3 to 0.5 mm reduction. Middle and incisal, it is 0.5 to 0.8 mm. Clear. Incisal reduction, yes, 1 to 1.5 mm. If you are going for an incisal reduction, it will be around 1 to 1.5 mm. And lingual reduction, if you are giving for a lingual coverage, you are going for a lingual coverage also, slight incisal coverage can be given for veneers. Okay, so that is 0.5 to 0.7 mm. Okay, now in general, what should be the thickness? When we communicate, means that when you answer the MCQ, in general, the thickness or the facial reduction of laminate veneers or the laminate veneers, it will be 0.5 to 0.7 mm. Okay, 0.5 to 0.7 mm. That should be your range. Clear? 0.5 to 0.7 mm. So this you have to by heart because this has been frequently asked. So gingival third 0.3 to 0.5 mm, middle and incisal 0.5 to 0.8, incisal reduction 1 to 1.5 mm, lingual reduction. If you are going for a lingual coverage, then 0.5 to 0.7 mm. Clear? Now coming to impression again, this portion also has been asked for your MCP, means for your NEET exams. Go for adhesion silicone, polyvinyl siloxane impression material, and you should inject the syringe material over the tooth surface, and this has to be recorded with a heavy body or a putty impression material. So you'll have to inject it around the prepared tooth. Again, over the putty also you have to inject it, then go for the impression. Only then you can record the margins. Clear? So there is no other. You should not go for alginate. You should not go for condensation silicone. Even condensation silicone can be used. You will have to pour the cast. Better to go for adhesion silicone. That is because they are the most accurate impression material. That will be discussing in dental materials. So I'm not going to that details. They are the most accurate impression material, dimensionally stable impression material, adhesion silicones. So go for adhesion silicone impression material as far as veneers are concerned, because you should be, even the minute details has to be recorded. The detailed reproduction is also for grade 4 your adhesion silicone impression material. So adhesion silicone impression material is the material of choice for impression for laminate veneers. Clear? Now going to provisional restorations. Provisional restorations, what we can do is you can give either acrylic provisionals or composite provisionals. Okay, provisionals will be taken separately for another session. So provisionals, what we give is composites, composite provisionals, or your uh, acrylic provisionals can be given. Coming to steps of bonding in ceramic veneers. Steps of bonding in ceramic veneers. Now, what are the different steps? This is an important region you should know. Okay. Why adhesion silicone is used? Yes, that's what I have discussed. Adhesion silicone, they are the dimensionally most stable impression material. One. Second one, the details, the fine details reproduction is also better for adhesion silicone. So these two reasons, because of these two reasons, it is better to go for adhesion silicone impression material for veneers. Not only for veneers, even if for a crown, I personally recommend it is adhesion silicone. Yeah, there is a negative side is that adhesion silicone are not that hydrophilic as polyethers, but still they are. Now we have got modified adhesion silicones are available. They are, which are hydrophilic in nature, means they have been combined the properties of polyether. So go for adhesion silicone impression material whenever you want to get fine details like laminate veneers, or when you go for a full coverage restoration with a subgingival margin, everything, you will have to go for a additional silicone impression material. Hope it is clear. Clear. Hope it is clear. Yeah. Shall I go up to next slide? So different steps in bonding. Okay. See, remember these steps. See, after preparation, tooth has been prepared. Now, before bonding, we have to clean the tooth. Yeah, we have to clean the tooth, clean it with the pumice and water. You have to clean the tooth, clean the laminate veneer. Yes, laminate veneer has to be cleaned with ultrasonic cleaning devices. Usually, that will be done from the lab. Now you have to etch the laminate veneer. The inner surface of the laminate veneers has to be etched. What is the etchant that we commonly use to etch the tooth? What is the etchant that we commonly use to etch the tooth? Anybody? Everybody will be knowing it. I want you to make a discussion. That's why. Commonly used etchant. Yeah. 37% phosphoric acid. Now, this thing cannot etch ceramic. This thing cannot etch the porcelain. Ceramic and porcelain, they are the same. Okay. Don't get confused when I use the term in between the porcelain and ceramic. Understood? So, what can be used? What can be used to etch laminate veneers or the ceramic or the porcelain? We cannot use phosphoric acid. That is a question that has been asked frequently. Yes. Hydrofluoric acid. Hydrofluoric acid is used to etch ceramic. Clear? So, whenever, if you want to bond a orthodontic bracket over a ceramic crown, the etchant used is again the same. Understood? So, you have a crown and you go for an orthodontic bracket placement over that crown, you will have to etch it with hydrofluoric acid, not phosphoric acid. Okay, the same way, what we use to etch laminate veneer, this is 10% hydrofluoric acid. Okay, so that is etching of laminate veneer. Then again, you have to salinization of laminate veneer. That means you have to apply a coupling agent, a saline coupling agent over the laminate veneer, which is similar to the bonding agent what we use in our natural teeth. Understood? So bonding agent, instead of bonding agent, what we are using here in ceramic, it is silane coupling agent or the coupling agent. Okay, the silane. So we'll apply that. After that, now we have to go for the tooth. Etch the tooth. Same thing, 37% phosphoric acid. Again. Then after that, apply, after etching, yes, bond the primer and the bonding agent. That is applied over the tooth. Then going for the cementation, removal of the excess cementation, light curing. Light cured, depending upon the cement what you have used. It can be light cured cement or dual cured cement. If it is dual cured, yes, again you can apply light cure and wait for the catalyst to act again, and it will be get cured by itself. Then finishing and polishing. So these are the procedures. So etching of the laminate veneer, it is done with hydrofluoric acid. Hydrofluoric acid, it is done, and in order to neutralize that acid, you can wash it off with water. Either wash it off with water, or you can use sodium bicarbonate gel. You can place sodium bicarbonate gel over the section to neutralize it. Clear? So remember, etchant is applied only in the inner aspect. Okay, not on the facial aspect, which is glazed, polished. We'll never touch anything over the labial aspect. Clear? Because it's already polished from the lab, and nothing will match the glazing that is done from the lab. Clear? Any polishing done by the dentist will not be equivalent to the glazing done by the lab. So we'll etch it from the inner aspect. After that, what is the purpose of etching? Yes, definitely the same thing what we have done in the natural tooth. Micromechanical retention. Yes, it will eliminate the micro cracks, enhance the wettability, and also cleaning also it is done. So micro pores will be there. It will increases the micromechanical retention. These are the property. These are the requirements, or these are the advantages when we do etching of the ceramic veneers. Clear? Again, silane coupling agent is applied. It is kept for 2 minutes and it is dried, means it is made to dry by itself. Okay, there is no need of curing of silane coupling agent. It will vaporize or it will set by itself. Clear? After silane coupling agent, etching the tooth, etching of the tooth is done along again with 37% phosphoric acid. In enamel, it is 30 seconds. And where dentine has been exposed, there might be some situation when we'll have to expose some dentine. In order to correct the smile rotation, we'll have to expose some dentine. Okay. So in dentine area, it has to be 15 seconds. That will be, remember, you'll be knowing, because in conservative, you might have learned that 30 seconds for enamel, 15 seconds for dentine. Okay. After that, rinse it, dry it, and no excessive drying, so that your dentinal tubules doesn't get shrinked. Okay. So again, after etching, then you can use, yes, while etching, you can use a matrix band to prevent the etching of the adjacent teeth. So the matrix band can be used in order to prevent the etching of the adjacent teeth. Then again, primer and bonding agent is applied. Either 2 to 3 layers are applied over it. Keep it there or cure it, depending upon the company's recommendation. You'll either go for light curing or self curing. Okay. So bonding agent is applied. Then cementation. So in order to place your veneers, you can use this instrument, laminate placing instrument. Okay. So laminate placing instrument can be used in order to place your veneers over that position. Clear? After that, the excess cement is removed with your strips. And again, in the palatal or the lingual aspect, you can use your burrs to remove the excess cement. So, hope it is clear. So, this is the basic procedure involved in your cementation of laminate veneers. So, we have discussed the indications, we have discussed the contraindications, we have discussed the minimum thickness of preparations required, we have discussed the cementation protocol. Clear? So now we'll be discuss few questions, 5 questions from this topic which has been asked. Clear? I want you all to answer. Clear? Indication for veneers include all the following except A. Diastema, B. Mild discoloration, high caries index, microdontia. So diastema, yes, diastema is an indication for veneers. Up to 3 mm of diastema can be closed with veneers. Mild discoloration, even mild or severe discoloration, any color or amount of discoloration can be masked with veneers. That is the advantage. Caries, see, in caries, high caries index, we won't give veneers, because already the tooth is subjected to high caries. So it is not recommended to give veneers for such teeth. Microdontia, yes, microdontia can be corrected with veneers. Many of you have answered. Yes, C is there. So that is the answer. C is the answer. High caries index. Clear? Sorry. Amount of labial reduction for laminate veneers. Amount of labial reduction for laminate veneers. Before that, I'll just discuss in the gingival region, it is 0.3 to 0.5. Middle and incisal region, facial reduction, it is 0.5 to 0.8. So here, most appropriate answer, remember, in MCQ, there is no perfect answer. Which option remains close to the answer, that is the answer. Clear? That is the protocol what we follow in our competitive exams. Even if you don't get the perfect answer, the answer which is very closest to the perfect answer is the answer. So here, C option, which says 0.5 mm, that is more appropriate. So it's 0.5 mm, 0.5 mm. Okay, this has been asked. The same question has been asked for your previous NEET exam. See, and they have given it as C also. So these types of confusing options will be there, definitely will be there in your exams. Okay, so answer is 0.5 mm. Clear? Impression material of choice. Impression material of choice for veneer preparation. Again, this is again a previous question. That's why I discussed the impression material for veneers. Again, the answer everyone will be knowing because I have discussed it 2 or 3 times. So adhesion silicone. Adhesion silicone is the impression material of choice for veneers because they are accurate, dimensionally stable, fine details can be reproduced. Again, for up to 2 weeks, it can be stored without pouring the cast. Okay, up to 2 weeks. Some companies provide it up to 2 weeks. Okay, to 1 to 2 weeks, it can be stored without pouring the cast. So these are the advantages of adhesion silicone. So impression material of choice for veneer preparation, it is adhesion silicone. So answer is A, adhesion silicone. Etching of ceramic veneer, it is done by, again we have discussed it, etching of ceramic veneer, it is done by 2 to 10% hydrofluoric acid. And if you have got options, different percentage, if you have got, the best answer is 10%. Okay, 2, 3, 4, 5, 10, all hydrofluoric acid percentages you have given in your option, which you have get it in your option, go for 10% because 10% hydrofluoric acid is more apt or more accurate answer. Okay. Again, citric acid is used for etching of the tooth surface for perio purpose. After flap surgery, you can apply the citric acid. Is done. Polyacrylic acid is again in GIC. The liquid in GIC, it is polyacrylic acid. It is again used. There was a technique in which before applying GIC, we used to clean the surface of the tooth structure with polyacrylic acid, then apply GAC over it. That used to be done in the previous days. So, so polyacrylic acid is used for that. For etching hydrofluoric acid, I mean for etching ceramic, hydrofluoric acid is what we use. That is 10% hydrofluoric acid. Hope it is clear. Again, indication for porcelain laminates. Indication for porcelain laminate. Again, the first question was actually contraindication. Now the fifth question, it is indication. All the 5 questions, all these 5 questions are previous NEET exams, NEET exam questions. Okay, so I haven't taken any single question outside the NEET exams. So indication for porcelain laminate: a teeth with parafunction, heavily restored teeth, crowded anterior teeth, stained anterior teeth. See, you can get confused with the crowded anterior teeth and stained anterior teeth. In between the crowded anterior teeth and the stained anterior teeth, the better answer, it is stained anterior teeth. Okay, mild crowding can be corrected with laminate veneers, but here they haven't told mild, severe, or moderate. Nothing has been mentioned about the crowding. But staining, whether it is severe or mild or anything, veneers are indications. So there is no confusion regarding the 4th option. So the answer is stained anterior teeth. Yes, I'm happy that many of you have responded. Many of you have responded and responded it correctly. That means you are following the class thoroughly. Great. See, this topic has been asked frequently. That's why I have taken it for the short discussion. And again, any details regarding, any doubts regarding it, you can ask it. Hope. Citric acid, I told you, citric acid, it is used for perio purpose, root modifications, reattachment cases. during flap surgery, we use citric acid. Okay. I'm not that much aware about the perio related percentages, but the citric acid is used for perio purpose, root after surgery for reattachment purpose. See, mild crowding, what we do, mild crowding means if you have slightly overlapped incisors, you can over prepare it. We can prepare that portion and correct it to the veneers. Okay. Mild crowding, that means the depending upon the severity only we can say. Mild, if you have slight proclination, that can be corrected. Only thing, if mild, it is slightly proclinated incisor is there, one incisor, only one incisor, then you can correct it. Slightly overlapped lateral incisor, that can be corrected. If you have two, means if the position, if the occlusal level position of two teeth are different, that can be corrected. That's a mild orthodontic means camouflage can be done with veneers. But when it is indicated purely for orthodontic treatment, you have to go for orthodontic treatment. Clear? So coupling agent. See, coupling agent, silane coupling agent, it is used. See, it is similar to the bonding agent what we use for natural teeth. See, after etching, ceramic has been etched. Now you should have some bonding agent that helps you to bond the ceramic with the resin cement, right? So that coupling agent is that agent which acts similar to the bonding agent of natural teeth. While restoring with composite, we etch the tooth, we apply bonding agent. After that, we apply composite over it, right? So that bonding agent for ceramic, it is coupling agent. Okay. So that is silane coupling agent. That is known as sialinization. Clear? Heavily restored teeth. Heavily restored teeth mean already the tooth structure has been restored with some other restoration. Understood? Over that, we are giving veneer. So if what happens if there is a crack over the restoration, the veneer is going to fail. So heavily restored teeth is not at all an indication for veneers. It is an indication for full coverage restoration. Already the tooth structure is less. It has been heavily restored. So it is not an indication for veneers. Clear? So answer is D. So this was today's session. I think it was beneficial to you all. Dr. Hima, over to you.
Thank you, sir. Thank you, sir, for your wonderful session. Tomorrow's class will be Dr. Jerry Mamens. It's on the topic principal fibers of PDN. It's, at the same